This is our second meeting during this special session. The date is Tuesday, September 7th. I'd like to welcome everyone to the meeting. If you do have a cell phone, if you would, just please turn that to silence or vibrate. If you're in the audience or if you are a committee member, we do have some members that are with us remotely. Just like to briefly go over our remote member procedures. Remote members can be considered present and they may vote on a bill if you're participating from your annex office. If you're participating remotely but not from your annex office, you can participate in the discussion of a bill, but you will not be counted present and you cannot vote. When you join the meeting remotely today, your microphones are automatically muted, so please remember to unmute your microphone before speaking. And if you have any question or comment during the meeting, please indicate that in the meeting chat function. Chris, if you would, please call the roll.
Senator Carroll.
Present in the room.
Senator Givens. Senator Harper Angel.
Present in my annex office.
Thank you. Senator Higdon.
Present in the room.
Senator Kerr. Senator Meredith.
Present in the room.
Senator Neal.
Present in the room.
Senator Southworth.
Here in the room.
Senator Stivers. Senator Thomas.
Present in the room.
Senator Wilson.
Present in the room.
Senator West. Chairman Wise.
Present in the room. Thank you all. Today we have before us Senate Bill 1, an act relating to the delivery of education and care for children declaring an emergency. We do have a committee sub for Senate Bill 1. I'd like to briefly explain the sub to Senate Bill 1. Section 7 that was yesterday presented in Senate Bill 1 said that school districts may develop plans to incentivize vaccinations. We had a robust discussion about this, and with that being a may, we also had the discussion that districts are already doing this. And so we have removed Section 7 from the bill, the original bill. So what you're finding before you with the sub was that removal of Section 7. So basically it was language that's already being done right now for school districts that they are doing. So we just completely removed Section 7. That moved then all the sections below that up. So Section 8 that dealt with certified staff working remotely moved up from Section 8 to Section 7. So everything from below that now goes in unison from all the different sections that we do have. Also, a change that was made yesterday is in Section 10 and Section 11 as it relates to the Kentucky Teachers Retirement System. This was caught by some astute attorneys that we had that there was a federal tax code issue involving the language that we had in the original version of Senate Bill 1. I'm not an attorney, but I will say in terms of what this language does is now with the sub, it will maintain the break from service for retirees to be only 1 month. It also removes the additional stipend and benefits above the existing limitations for retirees. Third, it extends the threshold from 1% to 10% of staff for hiring retirees. And lastly, the General Assembly will establish that filling staff vacancy qualifies for federal COVID-19 assistance money. Those are the changes that you find before you with the committee sub as it's presented today. President Stivers.
Thank you, Mr. Chairman. I'd like to speak on the sub, then have a motion. I've been very supportive of incentivizing individuals and entities to take the vaccine. I would prefer that this section stay in, but understand through logistics that it is probably better for the process to come out. As to the retirement components, KTRS and their outside counsel, and we can get into, I don't want to call it a legal diatribe because it's not done in a vitriolic nature, but a legal thesis, because of the separation period and distinguishing the separation period, it had to be changed to conform with federal law as the plan that we currently have, and you cannot treat individuals because you either that are involved in this, you either have to opt in or opt out. Once the option is taken, then it's set. So this language was requested. The change was requested. I don't know that the language was requested, but the change was requested by the TRS system. And so we are conforming to that request. So for further explanation, that was something we were in discussions with last night. I would then, with that explanation, would move for adoption of the committee substitute.
Before we work on or take that motion, we do have a comment or a question from Senator Higdon.
Thank you, Mr. Chairman. I just wanted to say that yesterday I had some issues with that Section 10 and with complying with the federal law that we've done in this. The issue we had with federal law, my issues were addressed, and so I'll change my vote today from a no to a yes. Thank you, Mr. Chairman.
Thank you, Senator Higdon. Senator Meredith.
Thank you, Chairman Wise. And this is an issue that you and I discussed earlier. It's under Section 5 regarding remote instruction. And I appreciate the change that's been made to the bill so far, but honestly, we're dealing with a situation we've never had to deal with before. And I think the remote instruction, the limitation on that, there's good justification for that. But again, for smaller districts, many that are within my Senate district, I think could use some additional flexibility with this. And I use the example, if you've got one elementary school that for whatever reason the virus is rampant, but it's not in others, then that 20-day limitation could be used up by that one school. And if you have another outbreak in another district or another school, then they're limited by this. So just to give them as much flexibility as possible, I really would like to see that change to be per school rather than per district, if that's a reasonable request. And I assume that's something we'll have to do by floor amendment, but that's a concern that I have.
Senator Mayor, thank you for your comments. And as the language, as we look at it, even with the sub as it relates to Section 5, where the intent is for as much in-person learning as possible. And we do know the time right now that we're in, we're trying to fix a problem for the now. And hoping with the coming weeks ahead, with a fall break, Thanksgiving, Christmas, that there will be maybe some opportunities there to work on the flexibility with those 20 days as we look to target that. As I said yesterday, I have full faith and confidence that we have some wonderful superintendents out there, wonderful school administrators and teachers and staff that can be very creative in how they can operate with what is given within the language as it states right now. And I appreciate and respect your concern as it relates to that flexibility. And we're hoping that, once again, the fix is for the now. And once we gavel back in January, if there's additional changes and needs that need to be done from then forward, then we can also look to do that as well. Thank you. Senator Thomas.
Thank you, Mr. Chair. And I want to begin with the point raised by President Stivers and his comments. And to be quite candid, as I'm sure everybody here is aware, I filed a couple of floor amendments yesterday. One did deal with using the schools as resources to promote the vaccine and get information out the vaccine to everyone. As all of us know here, historically, there have been two institutions in this country that have been relied upon for communities to address causes, matters of importance, concerns that impact that community, and that have been the churches and the schools. And the schools remain a community center for most of this country in terms of dealing with important matters. And there's certainly no more important matter in America today than this COVID virus. We already have language in one bill that is likely to pass that says that we're going to create centers to promote, advertise, encourage, incentivize people to get the vaccine. If we're going to eliminate the mask mandate, which that's where we're headed, then it just makes sense, since, as President Stivers has said, and I fully agree with that, we want to incentivize people to get the vaccine, that we use our schools as a tool to promote, encourage, get information out about the vaccines, get those 12-year-olds vaccinated so that we can beat this virus. I stand by my floor amendment. I think that rather than deleting Section 7, it ought to be expanded. And obviously I'll have more to say about that on the floor, but I think we're going in the wrong direction by eliminating Section 7. my other floor amendment that's obviously not in this bill, this committee sub, is the fact that if we want to bring retirees back into schools, which I don't think is going to happen in the numbers that we would hope, the teachers are worried. And I can tell you from yesterday, I've got numerous text messages and phone calls from teachers that are concerned about this COVID outbreak. As I mentioned yesterday, and I'll mention again today, we have 32 school districts as of today that are closed from COVID. 32 of 171 school districts are closed because of COVID. Okay. If we want to put our teachers at risk and encourage them to teach, and again, let me emphasize, I am in favor. I support in-person learning. I don't want to go back to total NTI. That is not working in our state. Then if those teachers do suffer from COVID, and there have been some breakthrough cases, then those teachers should not have to use their own personal sick days to take care of themselves. If we want to eliminate the mask mandate and thereby expose our teachers to risk, my other floor amendment says, and I think it's just the right thing to do, that if they're out, then have the school district or have us pay for them being quarantined and being treated for COVID. If we're going to put them at risk, we ought to at least pay for their time off so they can get well. One other point, and this is a new point, Senator Wise and committee members. I want to go back to the point raised by Senator Meredith. I think he has a good point that we really aren't giving full attention to. Senator Meredith's point, this is now in Section 5, says that you can do remote instruction for 20 days, and it can be done per school or per classroom, all right? But it's a district-wide limitation. It's 20 days per district. So, we're going to adopt test and stay, which I support. But if we're going to start narrowing our focus just to classrooms or to schools, and a school's out for 20 days, but other schools during that period have been in, and now all of a sudden we get to December, we're getting ready to get to finals for the end of the semester, and now school has to be out, and they can't get out, then that really puts that school, those children, and that community at risk for being exposed to COVID. So I think the language in Section 5 really, as responsible legislators, before we can move forward, needs to be cleaned up to say that either to eliminate the 20 days or to expand that, because otherwise we might encounter some serious problems if this COVID virus keeps raging. And now we get to the point where it's district, because one school has used up 20 days, can't provide any further remote instruction. We should address that problem on the front end. Those are my comments, Senator Wise.
Thank you, Senator Thomas. Senator Southworth?
Thank you, Mr. Chairman. My comments are really on this committee sub. I appreciate the work done to fix the retiree situation. I also appreciate in part and dissent in part on Section 7. I filed a floor amendment to solve this problem that I brought up yesterday. And the solution is not to just eliminate it. What we're essentially doing by eliminating Section 7 is not addressing the issue, leaving it hanging out there, kicking the can down the road once again, which I'm entirely against. And also, we're in a committee sub situation where obviously trying to eliminate floor amendments that a number of us have filed. And so I would encourage our membership to all help vote to be able to consider these floor amendments that are important. A number of us have mentioned. I think a lot of us are in that boat, and there will be a lot of discussion when we're in a short session. I really love the short, brief, to the point, try to get in here and get out, not spend a lot of time, but at the same time, these are very important and we need to spend a lot of time, and this is a precise example of why we need to spend that time. So I look forward to spending that time tomorrow on the floor. Thank you.
Thank you. Senator Givens?
Mr. Chairman, thank you. And we've heard some members direct our attention to Section 5 and concerns about latitude and the number of 20 being a limiting factor. In speaking to that, a couple of thoughts come to mind, and we certainly have tried very hard to delicately and appropriately target the needs of districts The 20-day number seems to be a number that we've arrived at through two mechanisms. This was presented and proposed and recommended in many ways by KDE, Department of Education, recommending this targeted remote instruction approach. And so there was a lot of engagement from KDE in arriving at the language that you see in Section 5. In addition, Mr. Chairman, as you directed everyone's attention in the previous committee meeting on this subject, Section 6 and us changing that core attendance number for ADA purposes for the upcoming school year by going back to 1819 removes the financial concern that so many districts have. And I think we had some testimony potentially in this committee, if I remember correctly, by some superintendents or others saying that once that financial concern is removed, and if they drop below whatever their number may be of 87, 88%, many indicate because they value in-person education so very much, they intend to continue going in person at levels as low as possibly 60 or 65%. So I'm confident that while some may have differing opinions on Section 5, I think we've all got to agree that we're providing flexibility here that districts have been asking for, and I applaud the work that you've done on this. Thank you.
Senator Givens, let me also note, and appreciate your comments, Section 12 from yesterday, now Section 11, also allows districts the flexibility with the 1,062 hours of being able to look at that for adding on any additional minutes to a school day to make up any days that may be missed. I go back to the conversation we've had before. Superintendents have asked for that flexibility of not using the days, but using hours as ways to make up days if needing to close down schools. I know I'm maybe one of the youngest ones on this committee, but I remember going to school in June from days that we had to add on to a calendar to do that. And I'm certain there's other members on here that remember from their school days doing that. While we want to hold on to the calendar as it is, we understand there are times when school districts shut down. And so I do think the flexibility that's built in there can also provide some relief as well. And just like Senator Givens mentioned, of the SEEK funding for the average daily attendance was an ask and something that we've put in here to help with that funding piece as well. Senator Neal.
Thank you, Mr. Chairman. My concern is that there's a possibility that because this is a committee substitute, that procedurally we will not be able to file amendments to the substitute if it's acted on today. That's my major problem. So can you give any assurance that this will not be acted on today so that we might be able to file amendments? And the reason why I'm sensitive to that is because I'm concerned about our treatment or lack of treatment to the question of NTI days, and I think there needs to be a robust discussion on that. And then secondly, just looking at the questions that are being raised here suggests that, and I know that, and this is in all due respect for those who have worked on this, because obviously a tremendous amount of work has gone into this, that this is a complex issue. We're dealing with multiple districts. The districts are not being impacted the same way, even within districts, particularly a district as large as JCPS in Louisville. And then in addition, you have a situation here where when we adjourn, we will not be able to act again if there are any shortcomings or we stop short in terms of what we do here until we come back in January, which means that that would extend to April? When we could actually, with an emergency clause, actually effectuate something else. So if you look at it from where we are to where we're going to be, and given the fact that we have tremendous amount of increase in those being affected in the schools, they're tallying data and information as we go forward, that we have a dynamic situation, we have an uncertain situation, we have a situation that suggests that we're going to have more problems. And although I applaud the flexibility that I see, to the extent I don't think it goes far enough. I'd like to be able to file a couple of amendments to address it and at least be considered. And that's why I asked the question, can you give any assurances that this will not be voted on today on the floor? I know that's not your call, but I know you're dealing with leadership with respect to that.
Senator Neal, and I appreciate the question. I think it was answered in your comments there. In terms of, I do not know in terms of once we leave here where we may be going. As someone who's just the chairman and not a member of leadership, I've not had those conversations yet with leadership to know what the daily routine will be. So I apologize for not knowing a fully complete answer of what that would look like.
And Mr. Chairman, if I may.
Please proceed.
Well, first of all, I want to, with all due respect, suggest that the work that you've done and the leadership you've provided has been positive and I think headed in the right direction. I do think that it has not gone far enough. That's my humble opinion. With respect to that, given the dynamics that I think that are out here, and I hope that leadership is listening to understand, and I think we all do understand the urgency of this. And here's why I raise this. You know, even though we talked about our kids that I think the national piece is that maybe 1 to 2% are being affected in very serious ways. The fact of the matter is that becomes real when it becomes personal to you, your child, etc. And I think we have a responsibility to do all that we can, not just some of what we can, but if we have the ability, we should do all that we can to make sure that those tools are adequate for those to act between the time we leave in this dynamic situation to the time we come back. So I would ask you, and you don't have to respond to that now, but I would ask you to talk to leadership and suggest that we not take a vote until tomorrow with respect to that. We got planning to do this, and and I think that I think it's warranted. But anyway, thank you for being patient and hearing me out, and I hope that it rings a bell.
Thank you, Senator Neal. Senator Stivers.
Mr. Chair, I want to direct this at you if you can. I think I know the answer. There are 20 remote learning days in this bill. Am I correct?
Correct.
10 NTI days that are still in this bill.
Correct.
The adjustment of the ADA, average daily attendance, which if a school goes below 87%, they will not be penalized for having low attendance rates on what we do from the state.
Correct.
And the 1,062 hours.
Correct.
So that would allow them to do a half hour, 20 minutes on the end of each day. That's pretty much the bill, that
Correct.
part of the bill.
Yes.
As I look at the calendar, this only goes through January 15th, which I gave the example of Owsley County and Corbin, because you get 5 inches of snow in Owsley County, you're out for the week. You get 5 inches of snow in Corbin, you're out a day. But if you look at the calendar, with 20 NTI or 10 NTI days, 20 remote, the ADA adjustment, there's only like 3 weeks that are not covered that they could go to one form or the other in this current semester. I think I look at that right, because so if we can't get into school for 3 weeks in this current semester, we've got a bigger problem that we think we have right now. Yeah. Because I pulled my calendar out. Next week, 1, 2, 3, that gets you into October if you went to, a school system went to. Actually gets you into the first full week of October. 10 NTI days gets you beyond Thanksgiving. So you only have, it gets you into the end of October, so all you have is the first couple of weeks of November and the first few weeks of December that you would schedule to be in school, and that doesn't include the ADA or the additional time on the school day. So for a semester fix, I think this is very adequate. And I know we have actually some differing opinions on that from both sides of the aisle, but I think the school administrators see this as well when you look at the overall calendar, that there would only be about 4 weeks that wouldn't be covered, and that's excluding ADA and the additional hours.
Thank you, President Stivers. I also want to make note, remember, one of the biggest concerns we've heard from committee testimony is the quarantine issue. We're also hopeful with what we're doing in this legislation that there's going to be a lot of changes that will take place with quarantining, testing to stay. If districts come up with their own protocols and procedures following certain guidelines as it relates to 3 foot and masking, there's so many things that can be done to help with the quarantine situation, which is truly knocking out so many kids with absenteeism. Not saying that there's not positives. There are positives. We understand that. But we've also heard from many superintendents that are saying we've got a large number of students missing 10 days that are not positive. They're caught up in contact tracing. So when you've got a district with 400 some students quarantined, only 2% of those are positive. Those are the issues we've got to solve too. We're hoping that can also help with attendance numbers. That can get students back in person learning. So I think what we're trying to do here is a best flexible method that's allowing districts to still have control over these days that are presented, remote learning, those 10 NTI days that are built in. So I do think there's very good flexibility, and I appreciate both comments of how we're looking to address this. And I think we're all trying to come at this with the same method and the same tone of trying to give districts as much help, but also trying to promote as much in-person learning as possible. Senator Neal.
I don't want to belabor the point, and certainly those comments made by Senator Stivers were very informative, and I think we're on point. I just want to be clear that my issue is it seems to me that if we miscalculate, and we have the ability to not miscalculate, in other words, we can put the proper triggers in this, we can defer certain decision making to KDE, for instance, we can put some guides on that if we do miscalculate, we have the capacity to respond in a timely and an effective way. That is what my major concern is. So, but thank you for allowing me to respond to the issue, and thank you for the work that's been done here. But I still must say that I think that we have the ability, we have the power, we have the responsibility to make sure that we are in a position in between our points of capacities to act, that we at least delegate some of that to a responsible party like KDE, who is knowledgeable and knows what's going on in all these in these districts, or at least it can respond to something that's unique. Keep in mind one thing, that we really don't know where this thing is going. We don't know how powerful it's going to be. And we don't know what the outcome is going to be, because that data is really being evaluated and accumulated over time now. So we're operating off of incomplete information. That's what we're really doing, because we don't know. Thank you, Mr. Chairman.
Thank you, Senator Neal. Senator Thomas.
Thank you, Mr. Chair. And I want to direct this point to Section 4 of the bill, which talks about the test and stay model. I think that's a creative model. And I support that part of the bill. But when you talk about a plan or creating a plan, there are really two components to that concept, Mr. Chair. One is the development of the plan, and then the second half is the implementation of the plan. Okay, and what Section 4 talks about, if one reads that carefully, deals with the development of the plan. It says in the statute, in this new statute that we're proposing to create, that each school district shall develop a plan for test and stay. Well, that sounds good. No one can be opposed to that. That's a reasonable approach. But then, how do you implement that plan? Okay, in the model that was presented to us last week, that's being used in Greene County quite effectively. It appears by that superintendent that those tests are being paid for, by a hospital or some kind of and Senator Gibbons, you can help me here, but it's being paid for by either hospital or some kind of facility that's paying for that. All right, and that's well and good. And where you can get that kind of free testing, go for it. But if we're talking about the state then having to pay for that cost, I will tell you from what I've garnered in talking to the budget director, it could cost the state anywhere, if we did it for all 171 school districts, it could cost the state anywhere, I want the members to hear this, anywhere from $16 million to $60 million per day. Okay, let me repeat that. It would cost the state, if the state had to pay for it, anywhere from $16 million to $60 million per day. Right now, we don't have the resources in the state to do that. So we can develop the plan all we want, but if we can't implement the plan, then developing the plan, doesn't do much good for us. And I just want to point that out, Mr. Chair.
Thanks, Senator Thomas. Senator Givens, would you like a follow-up to that?
If I may, Mr. Chairman,
Please
thank
proceed.
you. And Senator Thomas, thanks for the question. Let me share with you, as I understand the program, the way it works. These students, through the collaboration with the local health provider, the test costs are being paid by Medicaid, Medicare, and private insurance because these are insured individuals. So the collaboration with that local health provider provides access to the testing, which is then paid for through the children, simply filed as if the child showed up at the doctor's office and had an office visit. In addition, I was excited to read in the headlines, and you probably know more about this than I do, but Fayette County is running a pilot in some of the schools there, and I'm excited that Fayette is stepping into it. And I would encourage every district to step into this opportunity for Test to Stay because it minimizes the amount of quarantining we're having to do. And as you saw from the presentation by Greene County in the prior meeting, the number of positive students and that quarantining process, Greene County has been able to keep students in class, in-person instruction's happening, confidence in the program is building. Now, certainly with anything new, change is always one of the biggest challenges we face as humans in any system. But it appears that Greene County, as have other counties, have turned the corner on this model and are utilizing it very effectively. And so I'm excited that Fayette is stepping into it as well.
Thank you, Senator Givens. Any other members, any other comments? We have a motion by Senator Stivers on the committee sub to Senate Bill 1. Do we have a second? Second. We have a second from Senator West. Chris, if you would, please call the roll. Sorry, that is a voice vote. My apologies for that. All in favor of accepting the committee sub to Senate Bill 1, please do so by saying aye. Aye. All those opposed? Sub passes. We do need a motion and a second now on the bill as amended by the committee sub. We have a motion by Senator Givens. We have a second by Senator Carroll. Thank you. Chris, please call the roll.
Senator Carroll. Aye. Senator Givens. Aye. Senator Harper Angel.
No.
Senator Higdon. Aye. Senator Kerr. Senator Meredith. Aye. Senator Neal.
No, I'd like to explain.
Please proceed.
I could change this vote to aye. Perhaps having my amendment, which I intend to file, which I think will improve the situation and move this in the same direction we all want to go, I suspect, would change my position on this bill. So at this point, no.
Thank you.
Senator Southworth.
Split my vote, Mr. Chairman.
Please proceed.
I'm still going to be a no vote, although I do like the changes. There need to be more, but mainly because this committee sub-process, while I entirely agree that this is a great process, I'm very concerned, more than concerned. We have a giant issue on our hands trying to finish this session tomorrow under the current rules, and I want to take this opportunity to once again urge my fellow colleagues to help get these floor amendments heard so that we can actually do our job to be the people's voice closest to the people so that all of our voices and all of their voices are heard. So I'm voting no.
Thank you.
Senator Stivers. Senator Thomas.
Mr. Chair, I'd like to explain my no vote.
Please proceed.
Thank you, Mr. Chair. Obviously, I'm against the elimination of the mask mandate for the reason being that if we do away with the mask mandate and we're dealing with children that can't get vaccinated, then not only are we putting the children at risk, not only are we putting the teachers at risk, but we're putting the entire community and state at risk. And as I said before, I just think that's morally irresponsible. And so therefore that's the primary reason why I'm voting against it. Again, it makes it's only seems fair to me and just that if we're going to put these teachers at risk and they do contract COVID and have to be quarantined, some hospitalized, that we pay for that. We're gonna put one of my most valuable servants at risk and then not pay for their care. That seems unconscionable to me. I've got that floor amendment. I do hope it gets heard. I will file it again and hope it gets heard. If it doesn't, again, that's a flaw in the process. In addition, we all know here, regardless of how we vote, that vaccinations work. I don't see how we can, in one bill, say that we're going to have community centers that are going to be advocates for vaccination, and then not use our schools, which have always been community centers, not to promote vaccination. We're not mandating vaccination here, but to say that we're not even going to use our schools to send out forms, do announcements, have meetings to address the value of vaccination, just I think is burying our head in the sand, and I think that's wrong. So for all three of those reasons, in addition to the fact that while I appreciate President Stiver's point, we can get to the point, because as Senator Neal noted, we don't know where this thing is going. I mean, we didn't anticipate this 2 months ago, but here we are, back where we were when we started. I think that issue should be worked out about remote instruction and NTI days on the front end rather than on the back end. So for all of those reasons, Mr. Chair, I vote no.
Senator West. Aye. Senator Wilson. Aye. Chair Wise.
Aye. Just like wanted to explain one comment with my vote. Nothing in the committee sub, nothing in the bill is prohibiting a local school district from still promoting anything with vaccinations. There's nothing in here that's stating that can't be done. It's already being done. And also, with the KB mask mandate, yes, that's being removed. It's null and void. That still does not give districts the opportunity to still pass their local procedures and local protocols as it goes along the lines of masking, optional. They have the choice to do so. There is nothing in this piece of legislation that is saying that cannot be required at the local district level to make that decision. Just want to make sure those comments are heard as we pass the committee sub today upon Senate Bill 1. Any other questions from any other members? Seeing none, do we have a motion for adjournment? Motion. So moved. Thank you all.